Welcome to the Tennessee Heart Health Network webinar. Our aim is to be your resource for innovative statewide initiatives to improve primary care for all Tennesseans. We hope that you enjoy today's educational program and share it with your colleagues to make a better impact of heart health in Tennessee.
Who has access and who does not have access to healthcare. In general, 27.4% of low-income individuals lack health insurance. And that starts kind of like making sense when we look at the data on where are the poor health outcomes in our communities. So as a summary, we need to understand that as part of healthcare or the healthcare system as a social determinants of health, we need to understand that there is health coverage issues, that there are issues with provider availability, that the providers maybe are not meeting the needs, the linguistic and cultural needs, and sometimes people face differences in the quality of care that they have access to. Now we are going to move to other elements of social determinants of health. And I mentioned it before, and it's very important that we understand this, that a person's education and income are the greatest predictors of their health. So let's just start with economic stability. And I want you to tell me if the word economic stability tells you something. Why I'm not talking about jobs or employment, but I'm talking about economic stability.
Under healthcare.
No, that's a different. So now we close healthcare, and now we are going to start talking about other social determinants of health, which is economic stability. So remember, we have 6. We already covered 1. Now we're going to cover the next one, that is economic stability. But why it affects somebody's health? What could economic stability affect somebody's health?
Well, it could determine whether or not you have insurance coverage. If you're economically unstable, maybe you have a job today that has medical coverage and tomorrow you don't, or even the jobs that you have, none of them may have insurance provided.
So the concept of economic stability is extremely important. And we are not talking about just having jobs or employment or income, because you might have a job, or we know families that have 2, 3 part-time jobs and they don't meet the needs of their families, right? So having a job is not enough. Having employment is not enough. Having an income is not enough, because it doesn't mean that we can actually meet the needs of our family. What you mentioned, I think, Vanessa, is true. We might have jobs that provide us with health insurance, but also we have found cases of people who have insurance that cannot afford their copays, right? So I think the system is so complex that we need to start looking at the differences between every single determinant of health. So under economic stability, we do consider things such as employment, income, but also the expenses, right? And we are going to talk about that more in depth. Debt, medical bills, and support. So we know that in our country, healthcare is expensive, right? And it plays a huge burden in many, many families. So sometimes healthcare makes a large portion of their expenses, of their debt. And sometimes when sickness or illness happen in our families, it's like a storm. It's before and after the storm. Before, you might have some money, you might have some debt, you might have some costs that you might cover. Maybe you have the ability to work and you have probably health insurance or good health coverage. But sometimes after the health condition or the sickness, sometimes we find out that our families have less income and less assets, right? That they have additional debt as a result of the medical care that they have to pay for. They also find that they have difficulty paying for the basic family needs before that happened. And unfortunately, many families face bankruptcy out of their medical bills or the medical costs. For many, any kind of health-related event might feel like this wave, right? Like this is something that we can barely keep up. Maybe some of them might lose their job as a result of that. Maybe they experience changes in their job status. Maybe some of them find difficulty returning to work. Maybe they earn less than they earned before they have this health condition. And in generally, probably some people lose productivity as a result of poor health. So that brings us to a new concept that is financial toxicity or financial distress. And that is precisely related to the out-of-pocket costs that are basically what we have to cover after our insurance pays what they can pay, right? For some people, this is extremely expensive. People can't afford this kind of costs. So I'm going to bring just one example, and that is cancer, right? We, at some point in our lives, know people that are going through this journey. And it's extremely, it's a condition that really affects not just the person that is going through the diagnosis or the treatment, but the entire context, right? So just as an example, cancer is one of the most expensive medical conditions to treat in the United States. Secondly, several studies show that cancer patients and survivors are more likely to have financial toxicity than are people without cancer. Some cancer survivors report spending more than 20% of their annual income on medical care. Cancer patients with health insurance are paying higher minimum premiums than in the past and more co-payments, deductibles, and coinsurance. Cancer survivors may have financial problems many years after they are diagnosed. And sometimes it's hard for us from the healthcare system to understand sometimes when we have events or screenings in the community, why people don't want to get screened. And when you get more in depth in those conversations, people say, I don't really want to know because I don't know if I can afford whatever the result comes back. And now this gives you different perspective, right? It's not that people don't want to take care of the health. It's that the results might be scary, right? And it's hard to know how are we going to pay for that. What is the effect that this is going to have in my family, in my job? If I am the main breadwinner in my family, what is going to happen with my wife, to my children, to anybody who depends on this person? So now we are going to start the third social determinant of health, and that is education. And I want to get your thoughts of what do you think education might be considered a social determinant of health?
One reason you have to be knowledgeable of how to navigate and find hospitals or doctors, et cetera. And if you're not educated and don't have anyone to help you with those, to how to navigate and take care of your own, take care of your needs, or either, it may have transportation. You might not be even to know how to drive, but being educated plays a big part in it, because education is the key to success, So
Exactly.
if you don't know how to locate and find different necessities to stay well, then you're going to be lacking.
Mm-hmm. Who else would like to provide feedback on why education it might be considered a social determinant of health?
It may affect your job. I mean, you may have a higher level job with more education sometimes, which would provide you with more insurance, more available finance.
Mm-hmm. Thank you. Sandra?
Mm-hmm.
And I think education may also drive whether or not you seek preemptive care. You know, if you're checking things on the front end as opposed to just reacting when things actually happen.
Yes, thank you, Sandra. Joyce?
I feel that if education has a lot to do with it, because if you're unable to read the information that the doctor has provided to you and the side effects and all of those different things, that you might, you know, make a mistake, not knowingly, but unknowingly. And if you're helping someone else with their medication and you're not very clear or understand what they're supposed to be doing, say, for instance, you're supposed to get a capsule every 12 hours and you do it every 6 or something like that. So being able to comprehend what's going on with the medication makes a big difference.
Anybody else who would like to speak? So now with education, and based on the responses that I got from you guys, I'm going to make a difference, right? There is education in general, which is an element in life that will help us, and it's proven to help many people get out of poverty. One of you guys already mentioned education is the way for many people to get out of poverty because it can lead to better jobs, to better opportunities. Poverty, as I mentioned before, is related to poor health outcomes because of the access to resources. But also, you already mentioned is how difficult it is to navigate the healthcare system, right? And not understanding what the doctors are saying. So in this case, I'm referring to the first one, education as a way to increasing our quality of life, our opportunities in life. And that includes literacy, that includes language, higher education opportunities, as well as vocational training, but very, very importantly, early childhood education. Early childhood education might be this element that prepares you for the rest of your life. But unfortunately, we know that in our communities, not that many children have access to this kind of resource, right? If you live in an area that is has a low school educational attainment, that there are not early childhood education opportunities, the kids, when they get to kindergarten or first grade, there is already a disparity, right? It's different when you live in a household where you are exposed to books and educational materials that when you don't have that at family. At age 5 or 6, the disparity is huge, right? And this is extremely important because this is going to determine the trajectory in our life. Let's not forget the value of education and job opportunities as a way to get out of poverty. And poverty is one of the predictors of poor health outcomes, low socioeconomic status. Another element that is considered a social determinant of health is community and social context. How well are we integrated in society? What is the level of community engagement when we engage people from different walks of lives? What kind of support systems do we have in our community? And how is the discrimination in our community towards some specific populations? So let's think about this. And we are in different geographies, so we have different communities, but what kind of sense of belonging do we provide in our community? What kind of access to supporting systems and resources? And this is very important because now that the families are changing, that our social structure is changing, we see that in the past, families have parents and grandparents raise the children and create these social environments in the neighborhoods that everybody help each other. Now communities are different. And those levels of supporting system and resources in the community are kind of getting lost, right? Sometimes some communities experience shame and isolation. The family structures are changing, and sometimes the family support is also changing. And as you mentioned at the beginning, there is a lot of stress in our community, and there is something called allostatic load. That is the cumulative stress that families face, right? And it could be very specific, such as the stress that I'm having in the morning, not knowing how to feed my family or how I'm going to get to work, or I'm about to lose my job, or if there is crime in my community. So those different elements of stress are really affecting our bodies and our mental health. So now we have another element of social determinants of health, and it is called food access or food security. And lately, the concept is changing towards food and nutrition security. Why do you think that they're changing this concept, this wording?
Food and nutrition, it says, well, as the first one, it says hunger.
Mm-hmm.
If you're hungry and can't access the food, then you're gonna be lacking in nutrition. You know, you may have low, maybe anemia because you're not getting the right amount of servings per day, you know,
Mm-hmm.
during each meal. And then it didn't access the food. And you know, you have to have some types of income to access food. And if your income is at a property level, then you're not able to spend, like, you know, buy the necessities as you should. For
Mm-hmm.
instance, medication. If you're a diabetic, if you're
Mm-hmm.
in income and you need to be taking certain types of medications, then you can't afford to buy it, then you're gonna be lacking. So you're gonna as the food, if you can't get the necessary food to eat right, then your sugar's gonna be low or either high. It can be either one of them,
Mm-hmm.
because you have to have a certain type of food to the body needs.
And I
And then
think you have
food.
mentioned exactly the point in terms of now their conversation is not as much as just access to food, but access to nutritional food, right?
Right.
And
Right.
that is precisely the issue that we see happening in many low income communities. You might have access to food in a convenience store, right? But it's not the food that you need to thrive. It's
Your
not the
body.
it's not the food that your body needs to be healthy. So that's why this concept is morphing from access to food to access to nutrition, because you in reality need to have access to the right foods. Probably, unless you live in a very rural area, you have access somehow to some type of food. But is that what we really are targeting, or are we targeting access to healthy and nutritious food? And that is where the conversation is changing. And I'm going to show you some examples. This is a map of Knoxville. And this is a resort that actually you can access as well and look in your own cities. Here you can find like the darker areas, those are census tracts, areas where 100% of the population in that specific census tract have limited access to healthy foods, right? And that's very concerning, because that is related to our health outcomes. You guys said it from the beginning. What we put in our mouths is one of the elements that is going to determine how healthy or unhealthy we are. So let's get a little bit deeper in the concepts, right? What is considered food security? Is a family or a household that have consistent, dependable access to enough food for active, healthy living. On the other side, food insecurity is understood such as limited or uncertain access to nutritious foods. Unfortunately, when households experience food insecurity, it's usually about 7 months out of the year. That is a significant amount of time in a year of not accessing nutritious foods. And what are the consequences of food insecurity? It's not just going hungry, it really affects our entire life. First of all, we are going to see higher rates of diabetes, obesity, and cardiovascular disease. We are going to see a decrease in performance skills and cognitive development among children. So kids that are not fed properly are not going to perform the same as their peers. For instance, iron deficiency will cause anemia and increased risk for hospitalization among children. And we will see in adults a decreased worker productivity, which is also related to a social determinants of health. And finally, and we see this quite often in low-income communities, that poor maternal nutrition really has an impact in fetal development for a healthy pregnancy. What also you might be seeing is that some healthcare systems are taking this element very, very seriously because they know how important food is for the health of a patient or a community, right? And they are creating different ways in which they want to create access to healthy foods for their patients, right? They are connecting their primary care providers with access to what they call food pantries or food banks. They are connecting the access to those kind of resources to see their clinical outcomes if they improve their health outcomes, probably if they reduce their A1C or their cholesterol or their cardiovascular condition, etc. Sometimes they are connecting people in the emergency department with food security resources. Also, they are providing on-site education. Sometimes we might have access to healthy foods, but we don't know how to cook them. We don't have the elements to cook them or even the time to do that. They are also connecting patients with free resources related to nutrition in the community. And they are providing food for the communities in order to increase access to healthy foods. Another element is the neighborhood physical environment. And I spoke a little bit earlier about this. And I wanted to ask you, in how many of the communities you see this kind of picture? A group of elderly people just biking on the street safely, going to places. Right? This is a very, very unusual picture to picture in our state, right? Because we are not designing places to be physically active at any age, right? Sometimes if we go for a walk or go for a ride, we might be putting ourselves in risk, right? Because we are not designing places to do so. The same way, let's ask a question in our community. How many of us have a park half a mile from our house where we feel safe sending our kids or grandkids to play by themselves, right? Probably that's not the case of many of our communities. Also, when we see about different transportation options, sometimes we need to think about how hard it is for many of our community members to use transit if there is transit available in their communities. And I'm just going to give you an example of how much we need to understand the taking transit in our communities. For instance, if I decide to go from my house to my office, it will take me in the morning about 15 minutes if I drive, but it will take me over an hour if I take transit, right? So imagine if you have children, if you have to drop them off in daycare, in the school, if you have to get at a specific time at your job, as we all have to do. So sometimes we need to understand the level of stress added for those families that don't have reliable transportation or that they have to rely on public transportation. The other element related to neighborhood is affordable housing. And we know, I don't know how it is in this point in West Tennessee, but at least in Knoxville, housing is becoming a major issue because we don't have as much housing available for lower income families. That is becoming a huge issue in our community. But when we talk about housing affordability, what is affordable housing? That means that a household should not exceed 30% of the income in housing. At least in Knoxville, at least 1 in 3 households spend more than that, right? So when you're spending more than 30% of your monthly income in housing, that means that you are not, you don't have housing affordability or housing security. But also we need to look at different housing status in our communities, right? We have people that are housed and we have people that are homeless. But under housed, we have people that are housed, but they are at risk. They're about to lose their housing, right? And there are others that are stably housed. Also, homeless are not all the same. There are people that are chronically homeless that have lived in the streets for many, many months, many, many years, and there are others that are not chronically homeless. Some people might be, they need to leave their homes. They cannot afford to have them, and they end up in different situations like that. Sometimes when you have these conversations about housing, the conversation starts on why do we have areas in our communities where they have concentrated poverty? And if there is interest in this material, I highly recommend that you read about redlining and different policies that happened between the 30s and the 40s, where there were specific federal laws where specific communities and populations were not allowed to buy properties in every part where they wanted. They were limited to specific communities. And unfortunately, many of these communities were racial and ethnic minorities, were denied loans to buy houses in a specific. So if you see an example here in the red, those were areas where people might be at risk, right? They were they were they were receiving a lower score. They were considered hazardous. So people sometimes they were not accessing options to buy homes because of their race or their ethnicity. And this was by law at that time. So the book that I mentioned is called The Color of Law. If you want to know more about those federal laws that created this segregation in our community. But also wanted to bring to your attention some of the projects that healthcare systems are having across the country. And when I'm saying healthcare systems, those are very massive, very powerful healthcare systems where they understand that creating housing security, food access, providing people with jobs is going to help people have better lives and better health outcomes. So there are healthcare systems that are actively investing in affordable housing that include farming in those areas, and they're providing educational and apprenticeship opportunities to actually help people get out of poverty and increase the power and their income opportunities. So just as to summarize what is neighborhood and physical environment, that includes housing availability and the conditions of the housing. We also see that people living in older homes are exposed to lead and other kind of chemicals that were, let's say this way, not banned back then, and they're exposed to those these days. Also, the transportation optional alternatives, the safety and the sense of safety in our communities, the accessibility and availability of parks, greenways, sidewalks, and playgrounds. Walkability, which is primarily the opportunity to walk to places, to destinations, the noise and light pollution, and also the physical distance. Some people cannot afford living downtown or the areas where they used to live, and sometimes they have to find housing opportunities at the outskirts, which it's very far from their schools or their jobs, and that increases the level of stress in their families. So this is the form that you asked me at the beginning to share, and this is basically the summary of what I have presented. You see that social determinants of health, as a summary, falls under 6 different categories. And as a reminder, those are non-clinical factors that affect health. As a summary, those are economic stability, neighborhood and physical environment, education, food, community and social context, and the healthcare system. So if you have time, and I don't know if you guys have time for me to show this short video, or I can go straight to the end of my presentation. Please let me know how you would like to proceed, if you would like to watch it or if you would like to finalize my presentation.
We
I
like
would
to
like
watch.
to watch it.
Yes.
You want to watch it?
Yes.
Okay. Please give me some thumbs up if you can hear the sound, because sometimes with Zoom is a little bit hard.
Tennessee is a great place to live, but we're less healthy than the rest of the country, and that hurts our economy. Compared to the average American, Tennesseans are more likely to die from every one of the 10 leading causes of death. We're also more likely to say our health isn't good and suffer from depression and chronic disease. Healthcare is a major industry in Tennessee, so why aren't we healthier? Research shows there are 4 main factors other than genetics that influence our health. Clinical care includes whether or not you have health insurance, your access to care and its quality. Health behaviors are actions and choices like what we eat, if we exercise, and the use of tobacco, alcohol, or drugs. There's the physical environment, the air we breathe, drinking water, transportation systems, and having a safe place to exercise. And finally, the social and economic environment. Things like education, jobs, and income that give us knowledge, resources, and opportunities to stay healthy. We call these factors the drivers of health. Some drivers of health have more influence than others. Clinical care isn't the most important. Health behaviors and our social and economic environment both play a larger role. Some people call these factors the social determinants of health. What that pie chart doesn't show is how all of these factors influence each other. For example, access to transportation affects how easy or hard it is to get to the doctor or a grocery store. So how does Tennessee compare on the drivers of health? Let's start with a few social and economic factors. Tennessee has a better than average unemployment rate, but we're below average in education level and income. One major behavior that drives health is smoking, and Tennesseans are more likely to smoke than other Americans. Finally, the uninsured rate is a common way to measure access to clinical care. Tennessee's uninsured rate is higher than average. Now maybe you're thinking, I'm healthy, this doesn't affect me. Think again. Diabetes, hypertension, and cardiovascular disease are just 3 of the many chronic conditions you're more likely to have in Tennessee. And we pay a high price for those higher disease rates. Really, we did the math. Due to the difference between our disease rates and the national rates, these 3 conditions affected nearly 500,000 additional Tennesseans in 2015. That cost our state's economy more than $5 billion in 1 year in the form of direct medical care, lost productivity, and premature death. So yeah, Tennessee's poor health hurts us all. You'll find links with more information below. If you want to see more videos like this, click like and subscribe to our channel now. Thanks for watching.
This concludes my presentation, and I want to close with this quote. There comes a time when we need to stop pulling people out of the river, right? Like they're falling when they're sick. We need to go upstream and find out why they are falling. So thank you so much for having me today. This is my contact information. I can entertain any questions if you have any. If not, I appreciate your time and your willingness to have me today.
Thank you.
Thank you.
Thank you for
Great.
sharing all your knowledge with us today.
Thank you so much. I appreciate your presence here. Have a great day. Now, do you have any questions or?
Well, I was just gonna ask, now that you have all this information, what's being done to, are you leaving it up to, is it the information disseminated to different groups and they decide what piece of all of those determinants they're actually trying to impact and improve? Okay.
That's a very good question. So This is something that communities are taking at the local level, right? Because not all the communities are the same. So first of all, you are right. Every community needs to decide what is the priority. Is it housing? Is it food? Is it transportation, education? And different communities across the country are going different directions. Some areas are tackling food security or nutrition security. Some others are doing education. Some others are doing job preparation, etc. In Knox County, there is a big movement regarding nutrition security, but also housing security. And at the hospital level, this is a very new position at the hospital at UT Medical Center. We are started by training our own staff. This is something that it has been in the works for about 10 years, but it's very new to the healthcare systems. And we are starting to learn about social determinants of health, about health equity, and how can we do that from the hospital? How can we connect patients to resources in the community? We have Joyce.
Oh, yes. I would like to know if your slides all are available after
I can
your
share them with
presentation.
Gladys. Yes, ma'am.
Okay, thank you. I would
Yes.
like to share this information with someone else. Thank you.
Absolutely. Yes.
You mentioned a couple of things that I have never heard of before, and I wanted to ask questions about those. You
Sure.
talked about the food for life market as opposed to food banks. And it sounds, and from the example that was given, the doctor offered the patient the option of medication versus going to the food for life market. And I'm intrigued by that because very rarely does the doctor talk to you or give you options like that.
Yes, Ms. Linda. So hospitals are taking different approaches. Some of them are creating food banks even within the hospital. Some others are creating food banks or pharmacies, as they call them, out of the community. Some others are investing in community gardens, in growing communities, food in the community. So they have a myriad of approaches. Some others are providing food tailored boxes for their patients. For some Medicaid and Medicare patients, these costs can be covered as part of their insurance costs. So it depends state by state and hospital by hospital. They are addressing the issues very differently. And it depends on precisely groups like you, right? That you know the community, you know the issues, you know the needs, and you can advise your communities on even exploring new ideas on how to address whatever issue you think it is. If it's food related, housing related, transportation, you are the experts in your community, and I think that hospitals really welcome your expertise and your knowledge. But like I'm saying, is not one way to address this kind of issues. Each community is going by understanding the assets that they have, the needs that they have, and based on that, they will come up with different approaches based on the needs that they identified.
Okay, thank you. And you
But
also mentioned agri-hoods, which I've never heard of. Agri-hoods.
they are. That was an interesting project that I found that some hospitals are funding, where it's a housing development where they not only provide the housing, but also they're very focused on growing food within that area, that
Oh.
neighborhood. So they also provide education regarding that. So the purpose is not just to provide the food, but how you empower those communities to take ownership of the future of their communities, right? So it's not just providing somebody with a bag of food, but in some communities that is the need, but also is how you create this entrepreneurship, right? That you create opportunities for community members to create their own jobs or their own economic ventures in the communities. And we see that happening in Knoxville, where these grassroots efforts are becoming businesses as well, and they are being productive in terms of generating jobs in their community, but also generating the food that is needed in the community to feed community members. So like I said before, there is not one way to fix this issue because each community is different. So having different partners, having community involvement, such as groups like yours, I think is fundamental to find the solution in each community. And I think that you guys are very privileged to have this group of people that gather and want to learn and want to identify the needs of the community and the possible solutions to achieve better health outcomes.
Thank you. These are very interesting. These two
Thank
were,
you, Ms. Linda.
everything was interesting, but those two really piqued my curiosity.
And there are just two examples of very, very good things that are happening across the nation.
Yeah, yeah. I don't think they're happening in Memphis though.
But probably they will.
Yeah.
I know that a lot of good things are happening in Memphis, so I really encourage you to even explore this kind of new ideas.
Yeah.
There are very, very innovative things. Even I remember like here in Knoxville, they're doing things with food pantries in parks. They're kind of like changing the approach to food pantries and food banks. So they're testing, as I mentioned, there is not one way, and communities sometimes need to even identify funding and pilot ideas that they think might work. This pilot that I mentioned about the refrigerator in public spaces is funded by the American Heart Association. So that's funding that is available that you might also find for your communities. So bringing different partners is extremely important. So bringing hospitals and health departments and parks and rec and different stakeholders in your community is what is going to make these projects so successful. Not just one stakeholder, but actually bringing multi-sectoral partnerships is what makes these processes so successful in the communities.
Mm-hmm. Yeah, sounds great. Thank you.
Thank you, Ms. Linda. All right.
Okay, well, thank you again
Thank
so
you.
much for being here this evening and talking about this subject that's so important. We appreciate your time.
Thank you. And I
You're
wish you a wonderful night. And I'm going to join my family for dinner.
All right, have a good one.
Hopefully a healthy dinner. Have a great night. Bye-bye.
Bye.
Bye. Thank you.
You're welcome.
All right, guys, I'm going to hand it over to Ms. Tate so she can do our final remarks and meeting adjournment.
Okay. I was looking at the agenda
Mm-hmm.
saying Soulsville event planning as a patient what would you like to see? Why would you like to participate? Are we going to discuss this tonight, or it's just a question to think about in the future?
You guys can go ahead and answer if you guys have any suggestions, and I can write them down and then relay them back to Miss Gladys. I think that'll be helpful. She wanted to talk to you guys about that more in depth, but I think we can go ahead and if anyone has any ideas to jump off the brainstorm. Miss Tate, if you want to repeat the question for everybody to hear you.
Oh, it says, it says Soulsville event planning. As a patient, what would you like to see? Why would you participate? That's the Soulsville. That's the
It's a school, isn't it?
is that the
Yes,
school?
ma'am. That is
that
Go ahead, I'm sorry.
music and what is that? They teach young kids, young
Mhm.
children about
Yes, yes.
music.
Arts and music, arts and
No,
music.
I'm not sure what you guys are talking about, but that if I'm hearing you correctly, Ms. Tate, I believe you're saying Soulsville, that she's probably referencing our new location that is opening soon. It's going to be our third official location that is
Oh,
opening soon. And it sounds like she wants you guys to brainstorm on what would you like to see as far as event planning, programming, and different things as we plan to open up our third location from a patient advisory point of view, council point of view. What would you guys like to see?
I have a question. I don't understand when you say this is a third location. I'm
right.
located in Johnson City.
So that's what I
I
was
have
saying. I'm
no
not
idea
sure.
what you're talking about.
Okay, I'm not sure if Gladys, like I said, I'm just subbing in for Gladys. I'm not sure if you have a different syllabus, Miss Tate, but I think that she might have wanted to talk about you guys with that herself more in depth. But of course, if you guys know, we do have two locations, the UT HSC Health Hub, and then we have
What is-
Shelby Cares
excuse
on
me,
third.
again, what is you saying location? Location of what?
I just said the UT HSC Health Hub. Can you hear me
Well, what's
okay?
it, you know, but what is the hub? What is a hub?
Oh, you don't know about the University of Tennessee Health Science Center Health Hub?
I'm in Johnson City.
Okay,
I'm not in Memphis.
okay
There are
then.
11 hours difference.
Okay.
Okay,
If I get in a car and I can drive to Memphis,
Yeah.
so it takes me 11 hours.
Okay. What we're gonna do is we're gonna put that on for our next meeting agenda.
okay.
Miss Hunt does have her name attached to that, so that one may be something that we would want let Miss
Her to
Glad
talk about.
and talk about that the planning she's talking about. So
Okay.
However,
we're just gonna put
I
that.
can appreciate Mr. Val being curious about it. I just quickly Googled it, Mr. Val, because I was curious myself. And it's the Health Hub offers health coaches to provide a system of support. But if you Google, I think maybe they'll give us some intro to it. So when Miss Gladys gets back, we can get more information on it. And see, Soulsville is a part of Memphis that's in the center of an urban area. And they have a history of music. And what has happened is they built up a whole little community that started around this history of music. And so now they have a school and they put some medical offices there. And the whole area is just growing. It's like it's experiencing a lot of urban growth. So I can see where there would be a prime location for having some type of a facility that's focusing on health.
You are right, Miss Sandra, and I appreciate you saying those things because you are right. It looks as if Dr. Bailey is on and has his hand raised.
Yeah, I just wanted to help answer Mr. Voigt's question, and it's great to see everybody. For those I haven't seen in a long time, Dr. Jim Bailey from UT Health Science Center in Memphis, though occasionally in East Tennessee. Yes, the Miss Williams did a great job just with the old internet of talking about what the UTHSC Health Hub project is about. But over the last 3 years, UTHSC has been putting little almost like mini clinics in medically underserved neighborhoods to provide essential preventive and primary care services. So we've now opened, Colby Andrews works at our most long-standing health hub, which is in Uptown Memphis. Our second one is in South Memphis, and it's called Shelby Cares on 3rd. And we're about to open a third one in Soulsville, this neighborhood also in South Memphis. But all three of these locations use kind of an innovative approach in that they start with, they're basically staffed primarily by health coaches who do screening, coaching, and connecting to care. So they screen people for high blood pressure, for diabetes, for obesity. They do individual and group health coaching. So they do diabetes in terms of group classes and things. They do diabetes education, self-management education classes. They do diabetes prevention program, um, uh, support group sessions, and they do individual health coaching, and they help people get into primary and specialty care. So that's a little introduction. And I think Gladys is really eager to get kind of your input. The first health hubs, the first two, only were staffed by health coaches. But this third one in Soulsville is going to have some school nurses that work in the schools, some youth intervention specialists that work with troubled youth. And it's also going to have a little bit of primary care. It's going to have a doctor who's full-time on staff there. So the question for next month is really for this expanded service health hub that has the school nurses, a doctor, as well as some youth intervention specialists, in addition to its health coaches that are its core staff. What sorts of services do you think this type of entity could provide that would be most helpful to neighborhoods without a lot of primary care? So that's kind of the question.
Okay. Thank you, Dr. Bailey. I'm glad you're listening in on us.
Good to see you all.
Yes, good to see you too.
Yeah, thank you for that intro. Thank you.
You're welcome. Thank you, Miss Williams. I heard of the Soulsville. I'm like, and I know the young children, they was geared toward the young people. So this is most under health cares and what they're going
right,
to be.
and it's this particular one is partnered with the Soulsville Charter School and
Okay.
Stax Academy, which is their music academy, and
Yeah.
2 other schools in the area. So,
Okay.
you know, and it's this model using health coaches in an outpost in a mini clinic is something that there has been some discussion about trying in East Tennessee as well. So, so who knows?
Okay.
Might be relevant to the other end of the state as well.
Yeah, it sounds very interesting, you know.
Yeah, I participate in coaching at the downtown location with Kobe, and you know, the classes, the sessions, preventative classes, and you know, just the things that they offer at the health center. I found them very helpful. You know, just interacting and listening to other people who are dealing with their challenges. So I think the fact that, you know, UT is endeavoring to add an additional one, I think that's a great idea. But
Yeah.
I like it even more because this one is not only gonna, you know, include adults, but it's gonna take, because they partner with you know, the schools, it's gonna take into account young people. And I think that's really important because, you know, as adults, those of us who've had challenges growing up and with our own health histories, you know, as we learn, we need to be able to impart what we learn to the younger generation. And this is an excellent way for families to engage in work together to improve their health. And so I see that as being very helpful. The fact that they're partnering with them. And yeah, I agree. You know, there are some other things. I've always had some ideas, some other things that could be included in as a part of the coaching. And so, definitely when Kobe comes, I mean, not Kobe, when Ms. Gladys comes back, I think we'll have great conversation around it.
Okay. That's in the Macklemore area, right? Is that going to be in the Macklemore area, Dr. Bailey?
The 870 East Macklemore. Yes, ma'am. And I see Miss Brown has her hand raised, and then Miss Williams.
Yes, I was over in that area. I work with Tennessee Seal, and we were over in that area doing a event, a health event, and as far as them getting a hub over there, I think it's a great idea. There's a lot of college students out there. There is a lot of food insecurities over in that area. Also, there are, you know, a lot of things, a lot of information. With that hub being over there is a great idea. I think food, you know, we were talking and the presenter did mention about them having those food like clinics. Well, not a clinic, but you know, when they are giving out food, a food pantry, pretty much. Have they thought it or took it into consideration, those things like I saw on the internet about food pharmacy, whereas that the doctor will give like people with high blood pressure or somebody with diabetes, you know, even though it might be some of the items would be canned food, but some food that was not salt, some frozen vegetables, things like that, and fresh fruits and vegetables, so that that a patient can take home with them and have the classes where they can be taught how to cook those things. So I think that would be very helpful.
That's such great information. And it's interesting, there's others have said the same thing. There's an organization in Soulsville called Knowledge Quest that is eager to work with us to offer some of those things.
That's good. That's great.
Miss Williams, and then I should probably be quiet and give it back to Ms. Tuck.
Okay, thank you, Dr. Bailey. No, I was just saying we have had such wonderful speakers and useful information shared, but we just, we take what we can personally and for our benefit and our family's benefit, and we go on. But when you look at what Liviana shared with us this afternoon as a board, if we're looking at, if we can take some of that information and decide, okay, a lot of those areas we can impact, or we can sit up and make decisions based on data and do research into certain areas based on data. And then that'll help us make more grounded recommendations and really use what's being brought to us. We get so much that we don't use beyond just what we do, but with what she presented and with it being in non-medical expert terms, it's just in layman's terms, it's things that we can understand and we can relate to. So I think that as when Ms. Hunt gets back with us, if we can look, and if she shares that video, because I'm certainly willing to look at that again too, but she shares that with us, and we can try to figure, okay, what can we impact? Is there a specialty? Is there one particular area of focus that we want to recommend for Soulsville to really impact some, things that will help the community and help everybody in the long run? So I'm looking forward to seeing it.
Yeah, Dr. Bailey, I think that's a great idea, having it in the Soulsville area. I did a project at that Memphis Rocks, that's the rock climbing gym over there, and we spoke about heart disease and never being too young to acknowledge heart disease and just general health. And it's very interesting that those children can come after school and they're provided a snack and food at the rock climbing, along with the other abilities to do different things. And we also, I have the project where you paint heart rocks all over the city. And we took rocks and let the kids paint them the day before. And then we came back the next week and had a scavenger hunt. We hid the heart rocks all over. So it had a lot of meaning. And then afterwards, we made a heart rock garden there, and the kids helped put it together and present it. So there's a lot of good opportunities there. And that was one of the greatest little projects I've ever done.
Huh?
That's great.
Well, thank you for letting me drop in on Gladys's behalf, and great to see everybody. I have to sign off. I'm being called away as well, but thank you all.
Thank you, Dr. Bailey.
All right, Dr. Bailey.
All right, this is Mrs. Tate back. Just a reminder, the next PAC meeting date is May the 28th. That will be the 4th Tuesday of May. It's May the 28th. If there is no other concerns, then I would like to someone to motion and second the motion that the meeting be adjourned for the night.
I move that the meeting be adjourned.
I second that emotion.
Okay, then. On that note, we will see everyone bright and shining in May the 28th at 6:00 p.m. for the next PAC meeting.
Thank you.
Yes.
Okay, thank you, Ms. Tate. Good afternoon.
Bye,
Everybody
y'all.
have a good afternoon.
Bye, everybody.
Okay.
Right.
We hope that you've enjoyed today's webinar. For more information and resources, please visit our website, tnhearthealth.org. You can find more webinars under our resources page. You can also follow us on Twitter, LinkedIn, and YouTube. Please let us know if there are any specific topics or speakers that you would like us to present. Lastly, tell anyone you know who would be interested in helping to decrease the burden of cardiovascular diseases in Tennessee and share the webinar. Together we can achieve our goals of managing and preventing heart attacks and strokes for Tennesseans.